El impacto.
The impact is notable when a woman is unwell, affecting her not only physically, it affects her economic situation because she is unable to work in the same way. She won't be able to function in her work environment.
Hemos visto en estas últimas gestiones.
We have seen in recent years that breast cancer has been increasing not only in the number of patients with breast pathologies, but also in its prevalence among younger women. The high mortality rate is exacerbated by the fact that 90% of women diagnosed with cancer suffer abandonment from their partner or spouse.
Estaba trabajando de lo más tranquilo.
I was working as usual when suddenly I felt a sharp pain, a stabbing, right here. A year went by before I went to the doctor. The laboratory analyses reported that it was a malignant tumor. They told me it was cancer and that I had to have surgery.
Es mucho más complicado para una mujer.
It's much more complicated for a woman to make the decision to undergo surgery because she is first considering her family's needs. Women put their loved ones before themselves, and only when they are really sick, they come to Puente de Solidaridad and say, yes, I need surgery, or they come when the pain becomes unbearable.
My mom doesn't know. She doesn't know because she has a heart condition. And I'm afraid that if I tell her anything about it, she may get upset. I'm very worried for my mom, for my daughter. They depend on me. I'm afraid that if something happens to me, I don't know what will happen with my mom and my daughter.
Solidarity Bridge.
Solidarity Bridge has made it possible to provide integral support, not only for financial needs. The support has an emotional impact on the women. It makes them say, wow, they are thinking of me and have come from another country to care for me when I thought I didn't matter to anyone.
Se presentó la campaña.
The surgery campaign was scheduled, so the doctor told me we'll be able to operate on you sooner.
I think one of the unique relationships about Solidarity Bridge is it has boots on the ground here in Bolivia with Puente de Solidaridad. And so having the team here constantly being able to do things for the Bolivian patients to get people ready for the surgeries for our campaigns, that's really important to me, that we're not just people that are coming in and leaving, that there really is follow-up with these patients after, follow-up with their families, long-term continuity of care, because that is one of the principles of being an OBGYN and a GYN oncologist, is caring for a woman over the course of their life.
Perdía mucha sangre en mi regla todos los meses.
I lost a lot of blood every month and I was scared. They referred me to the ECO hospital where they have continued my care for a year and a half.
They have a lot of patients who come in with advanced cervical cancers who are profusely bleeding and they don't have good ways to stop it.
Me llamó un día la doctora Guaigua.
Dr. Guaigua called me and explained me that there will be a campaign. Without thinking twice about it, I went the next day in the afternoon to talk with the doctor.
And this is my third trip back. We've been here every October since 2022, building on laparoscopic surgical skills and complex gynecology skills to care for the patients here. So my goal when I come down here is to work with them on advancing their laparoscopic skills, which allows us to do surgery with little incisions, allows patients an easier recovery after surgery, and really just gets the patients back to doing life as opposed to recovering from a big abdominal incision.
Después de la cirugía,
after the surgery, I felt well. I came out very relieved. Eternally, very grateful to Puente de Solidaridad and Solidarity Bridge because they support me. They talk with me. They call me.
Gracias por...
Thank you for helping me. Thank you so much.